number 83, and I left it false labor pain, goes in OB, epidural. Prior to lumbar epidural block, what should patient do? Void, just like lumbar puncture. What do you do for lumbar puncture? Voiding, same thing here. What do you monitor when you give epidural? Is hypotension, very important that you need to monitor the blood pressure. Now on the other side of the page is 84, and it says during the newborn baby. Remember, newborn baby is important for Nclex. Everything possibly you can learn is good. What do you check when the babies are born is we call Apgar score, right? And also airway, very important. Apgar score 1 to 5 minutes. What is a normal good score would be when the babies are born? 8 to 10, 7 to 10 is good. You don't have to worry. But what about if they're saying is 1 to 3? 0 to 3 or 1 to 3 is very poor. What do? Resuscitate the baby. You have to resuscitate to let them live. But what happened, so this is not good unless you resuscitate. 4 to 7, what do you do 4 to 7? Is still monitor. Your baby is not completely good. So what do you monitor here? Is airway, and always remember newborn baby, premature baby is minimum handling is a good answer. Minimum or minimal handling. Why? When you handle, they're losing their warmth, and handling, they can lead to what? Respiratory distress and colds. They become more cold. And cold is not good in the babies. That's why you keep them warm. What happens if they're cold? They're going into respiratory distress. Are we clear? They're losing a lot of energy. Maintain warmth is very important. If you have premature baby in a special unit, they're going to keep them. And to keep them warm, maintain the temperature, cover the blanket, very important. And also ID band with the mother and infant. You got to security purpose in the newborn baby. Now, then we go once the baby is born in lochia. We all know lochia is a bleeding. Rubra is bloody, 1 to 3 days. Serosa is pink, 4 to 9 days. Alba is after 10 days, which is yellow color. Now, that's important in lochia. Now, remember is fundal height. Where is fundal height when the babies are born, or where would be your height of the uterus when the babies are? At the umbilicus, maybe a little bit umbilicus, but not on the right side. Why? That's a full bladder, not too high. At the umbilicus or below, maybe your below umbilicus, but not above. Are we clear? So that is a normal. Your lochia, after lochia is there. Now, if mother is bleeding a lot and baby is born, then what does it mean too much of bleeding? What is too much of bleeding? If after baby is born, mother is bleeding, what do? Check for contractions. Why? What do you give them? You got to give them is the medication as methergine, not pitocin. So write down the word methergine. Methergine is given for contraction. That means the uterus is not contracting, and there may be retained placenta. So there may be the reason for bleeding. Write down the word retained placenta. That means some part of the placenta is still retained. So you got to give contraction. Second answer, you will go empty the bladder. Sometimes the mother is full bladder and they're not contracting. So what do you do if the fundal height, the fundus is higher and above umbilicus or on the right side? The reason is full bladder. Are we clear? So what is important for the mother here? To empty the bladder. Number 1, give methergine and massage. You can also do the massaging the uterus. So that goes in there. Lochia is good, and that is one part that we need to know. If fundus is displaced, that means is bladder distension. And if they're saying displaced means is the right side. Are we clear? It's not going up, but it's moved. If the pads, how do you know the bleeding? Count the number of the pads, 15 minutes, or put soak pads in 15 minutes, that means check for bleeding. Are we clear? If the pad is soaked in 15 minutes, is the bleeding. Ectopic pregnancy. What is ectopic pregnancy? Is not normal. Where is it? In the fallopian tube. So write down, in the lower, pregnancy is in the fallopian tube, and it shouldn't be in the fallopian tube. Now, what does the sign and symptom? Because you have two fallopian tubes are on the side, so there may be they are having a pain, unilateral pain maybe, or lower quadrant pain. The mother has a lot of pain. Rigid abdomen. And if she starts bleeding with ectopic pregnancy, so sign of ectopic pregnancy are pain and hemoglobin and HCG level, lower hematocrit and HCG level. What do you monitor for ectopic pregnancy? Shock, because they're bleeding, that's why. And what may be given at this time? ROGAM. And I want you to write down on the side, ectopic pregnancy, and what are the signs would be? A spotting or bleeding. So write down on the side, spotting and bleeding, and monitor for hypovolemic shock. Mother may go in shock, and you give them the fluids. You can give them IV fluids to the mother. That will go in ectopic pregnancy. Are we clear? So we all should know fluid is important, the blood is important, and you're treating the mother for sign can be spotting and the pain. Pain can be on the right side or on the unilateral. Now, what are the assessment implantation of placenta previa? Now, we already talked about placenta previa. Where is the placenta previa is abruptio placenta is up, placenta previa underline lower uterine segment. Where is the placenta? In the lower uterine segment, or they are saying the word cervical os. Os means opening. Cervix, very close to the cervix. The bleeding start early. First trimester or second trimester mother is start bleeding and painless and profuse bleeding. And I want you to add there, sometimes they use the word abdomen would be soft in placenta previa. Because the placenta is in the lower, abdomen is soft. Then you will go bed rest, you will do, or because mother is bleeding, maybe Trendelenburg, like a shock position. Ultrasound is important. Anytime mother is bleeding, would be the best is ultrasound to do it. No vaginal and no rectal exam. And also for lung maturity, what do we test? We do amniocentesis. And also check hemoglobin, hematocrit, and monitor for bleeding. I want you to add there stop Pitocin. You make sure if mother is start bleeding, you stop Pitocin, and vital sign is important. Also give maybe IV fluids and maybe the blood transfusion. And placenta previa, mother will go for C-section. So add there cesarean. They will not do normal delivery, but C-section and no vaginal exam. Abruptio placenta is, I want you to add there, placenta is in upper uterine segment. So make sure we all know upper uterine segment. Are we clear? So it's in the upper part. How does the mother is having, why she's having bleeding? Premature separation of placenta, and write down hypertension, preeclampsia is the reason, or mother's health. Maybe mother is having some other disease. Maybe mother start taking some drugs can lead to abruptio. So abruptio placenta, mother should not have bleeding. Are we clear? Because it's normal. But there is the reason, and everyone remember hypertension, preeclampsia can lead to abruptio placenta. And what kind of bleeding? The mother is having pain. So remember, vaginal painful bleeding. Abdomen is tender, painful, tense, and write down hard. Abdomen is hard like a board. Sometimes they use the word like a board. It's hard. So remember, that can be there. And what do you monitor mother and baby for fetal distress and immediate delivery? If you can go, if fetal heart rate is normal and no fetal distress, you can add there, fetal distress, then you can go normal vaginal delivery. If there is a fetal heart rate is bad and baby is having distress, then you go C-section. So remember, abrupt show placenta, because the placenta is right here and baby is right here, so they can remove the baby easily if only conditioned when baby is okay. Are we clear? If there is a risk in a baby, then you have to go C-section. But yes, there is a possibility you can deliver the baby normally. Are we clear? So cover abruptio placenta, placenta previa, everyone should know. And what is the complication of abruptio placenta? Underline the word DIC and pulmonary embolism. Now, I'm going to move on, page number 85. On page number 85, very important is diabetic mother. When you are diabetic, always remember you do not give oral medication. So 20 weeks, when do you monitor all mother, what month or what period that they are risk for diabetic? 20 weeks, underline. All the mothers should be screened for diabetic around 20 weeks. Oral hypoglycemia medication contraindicated, so you only give insulin. And all the women age risk is for 20 early and older mothers, or if they have multiple pregnancy. I want you to add there, multiple pregnancy. If mother has twins and triplet, they are risk for diabetic. If you are older age, you are risk for diabetic. If your family history is there for diabetic, you are going to be diabetic. So which mother are you going to monitor for diabetes? Number one, multiple pregnancy can lead to. Older age can lead to, so underline that. And also, is test for diabetes around 24 to 28 weeks on all women with average risk 20, frequent monitoring for mother and fetus during pregnancy. So hypoglycemia, mother can be 20 weeks. You can screen them around 20 weeks and test for diabetes again 24 to 26 weeks. Now, what do you teach them about insulin? Now, when do you need to have more insulin and when do you have less insulin do you need in diabetic mother? Any idea? If you, after when the baby is born, do you give more insulin or less insulin? Less, right? When do you have less insulin, mother needs it? Less insulin is early pregnancy, early, that means first and second trimester. Early as they are, that you don't really need insulin more. You need to check blood sugar. But if you are going first trimester, need of insulin is low. Second and third trimester, insulin you will need more. After baby is born, you will need less insulin. So, monitor, because they are already hypoglycemic. So very important, all the trimester, you monitor for blood sugar. First trimester, your insulin need will not be very high. Are we clear? Your insulin needs with the mother will increase when she is moving in second and third trimester. After the baby is born, you will need less insulin. So early and last, you will need less insulin. And what test do you do? Glucose tolerance test. Write down glucose tolerance test. So what is glucose tolerance test is? You give glucose and to drink. Tolerance test is you draw the blood and check for hyperglycemia. So mother, what is the risk for mother who is diabetic? What do you monitor mother and the babies after, if suppose mother is diabetic? Okay, what do you monitor after delivery? Now during delivery you're monitoring. What are the complications after delivery for a diabetic mother?
Baby hypotension.
First thing is the baby is going to be big and also hypoglycemia. Very important, hypoglycemia. So write down when babies are born, mother is diabetic, what do you monitor? hypoglycemia, large baby's weight is going to be big. Respiratory distress, write down the word respiratory distress. And also congenital deformities. They can also have congenital deformities. I want everyone to know, is diabetic mother, risk for the babies are, they can be hypoglycemia. And in hypoglycemia, remember, they also have calcium level low. And the baby's sign of hypoglycemia, I want you to write down jitteriness. They are jittery babies, they're called jitteriness at there. And that is sign of hypoglycemia. Baby's weight is going to be higher. And respiratory breathing problems. So definitely, mother is diabetic, you monitor the baby for respiratory and congenital deformities. Are we clear? So that goes in your diabetic questions. Now I'm going to go hydratry mole. What is a hydratry mole is a mole. It's not a pregnancy. There's not a baby. There is a mole. And what is the sign? So really, it's not a baby there, but is a big mole. And uterus size would be bigger than the date. Mother looks more big because of the mole. Are we clear? And what is elevated? That's a very important answer. If there is a question with hydratry mole R, check for elevated what? HCG level. And number 3, there's no fetal heart rate. There's no baby. And mothers start having a bleeding and the color is more red-brown and vaginal discharge. And underline the word sign of hydratry mole R, they are clusters. What kind of clusters? Grape-like clusters. So if they give you mother has grape-like cluster, HCG level is high, there's no fetal heart rate, that means you're talking about what? Hydratry mole. There is a mole. And elevated HCG level. It can cause nausea, vomiting, and blood pressure, mother can be high. So sometimes hydratry mole can lead to preeclampsia or hypertension. And what do you do for the mother? For that is you remove them, is curettage, DNC. You got to remove the mole. There's no pregnancy. And do not use for 1 year. Pregnancy is not, mother should not get pregnant. Are we clear? And HCG level monitor for 1 year. Why? I want you to write it down. These moles are not cancer. And they are turning into what? Is the cancer. So that is why it can lead to what? Cancer. So these moles is cancerous, and so in the beginning they were not a cancer, but it can turn into cancer. Are we clear? So a lot of time when mother had hydratry mole, they may have to remove the uterus completely because if they had the cancer. Are we clear? So what do they do? They can take it out, DNC, and also what do? Is they will monitor HCG level for 1 year. And what do you tell the mother in your teaching question? Is not to get pregnant. Are we clear? Why? Because it was non-cancerous, but it can turn into cancerous. So 2 things everyone remember. In hydratry mole, HCG level, and next thing you remember, they have a grape-like clusters. And HCG level is going to be very high, and do not get pregnant for 1 year and monitor for cancer. Now, normal vital sign. I'll tell you, you never know how your questions are, and you cannot judge, you cannot pick up wrong answer. You've got to know their normal temperature, heart rate, 100 when they're awake, 120, 140, 180 can be when they're crying. So it's not going to be less than 100. Has to be more than 100, your newborn babies. And respiration, you must know 30 to 60. And also your blood pressure. So these are very important for your exam, that you know what is a normal temperature. 97 to 99.7 consider under normal. Are we clear? And next is hyperbilirubinemia. means his bilirubin is high, and also underline the word hepatic function and underline the word physiological jaundice is normal and no treatment. Seen after physiological jaundice 24 hours, and it can peak normal jaundice 72 and last 5 to 7 days. Now, how do you lower the bilirubin level is immediately. If they say baby has a jaundice, what do you do is start right away breast milk or fluid to lower down the bilirubin level. And it can be caused by poor milk intake, onset 2 to 3 days, and peak can be 2 to 3 days. Breast milk jaundice, discontinue breastfeeding for 24 hours caused by factor in breast milk. That can be if that is a question. And then hemolytic is if you have blood problem, and then phototherapy, you can give them. And what is in the phototherapy caused by also phototherapy, exchange transfusion, RH incompatibility can lead to your hemolytic disease or is your jaundice. What do you remember in phototherapy? What do you remember in phototherapy is cover the eyes and cover with the, they must have their diaper. So you are covering the genital area and eyes. And what do you do when you're giving phototherapy? Turning frequently, very important. So write down with phototherapy, turn. What is turning means? You are giving phototherapy all over. So you got to turn the baby in positioning. So change the position frequently. Number 2, because your heat is drying the body fluid, dehydration. So what do you do here? Write down increased fluid. So make sure you give fluids. And also check the eyes. So check the eyes. It can be, make sure the baby's eyes are okay. And number 4, the mother can touch the baby. Mother can stay sensory, lacking of sensory perception. So touching is okay, but you cannot remove the baby. Are we clear? And check the diapers because it should be coming out from the body through the urination and the color. So check the pads, make sure the babies are not too dehydrated. Make sure you are giving fluids, you are turning, eyes, and touch. Those are sensory perception. Some of your answer can be on there. Now, I'm going on the next. I'm telling you, these are very, very high pages. What new thing are they looking in Nclex exam? If you don't know the normal baby, you're not going to answer abnormalities in the boys or in the girls. Are we clear? So that's why growth and development is important. Newborn babies are important to know. And now your narcotic addiction and addicted. Alcohol withdrawal with the mother who is drinking alcohol. What do you monitor now? Narcotic addict babies are. Whenever they give you high-pitched cry, that's something wrong in the brain. High-pitched cry. Next is hyperflexia, their movement. Decreased sleep, underlying tachypnea. Their respiration is more than 60. Very important, pitched cry. Underline the word sneezing and yawning. And seen at 24 to 48 hours of age and up to 7 to 10 days. So when do you see sign and symptom? Assessment for narcotic addiction babies are 24 hours. Maybe it can also run 7 to 10. So very important. Any narcotic, they're giving you addicted babies, monitor for the high-pitched cry. Are we clear? High-pitched cry, tachypnea, yawning is not good, sneezing is not good. And then you will go, what do you do? Implementation. What do you do? Implementation. Quiet environment, no stimulation because they can go in seizure. So keep them in quiet environment. You can give the medication phenobarbital, and that is more diazepam. Diazepam is your Valium. So you can give Valium, and you can give them is phenobarbital, and wrap the baby snugly. Keep them, wrap them, and also rock and hold tightly. That also keep them close. Are we clear? Prevent them from seizuring. Muscle tone, assess. Irritability. If they're saying irritable baby, high-pitched cry, that's not good. Vital sign, you assess. Everyone should know narcotic withdrawal babies and alcohol mother babies sign and symptom. Now, what are the assessment is sudden onset fever. Any fever comes all of a sudden is not good. Now I'm going to move on page number 87. And page number 87, we have toxic shock syndrome. Toxic shock syndrome is in the females that you have toxic shock, and sign and symptom are vomiting, low blood pressure, rashes on the palm and the sole. And the reason are tampons is educate, use, change the tampon. Toxic shock syndrome is bad infection. Antibiotic, change the tampon frequently. So it can come from not changing the tampon, and it can lead to toxic shock syndrome. And what do you give them? How do you treat them? Antibiotic. Are we clear? And habits. Contraindication for immunization. Now we have talked about immunization. Make sure immunization, you guys have to memorize. A lot of questions are coming in immunization. Contraindication is severe febrile illness. Severe. If they're saying severe febrile, that means it's infection. You don't give immunization. Immune system. Write down any word, low immune system. Do not give live vaccine. Live vaccine. Oral polio vaccine, MMR, they're live vaccine. And allergy, any allergies before patient has it, with that, don't give it to them. Immunity, recent acquired passive immunity, do not give them. But definitely you remember two things, immune system and also when you are febrile, fever. A cold symptom is okay, but very febrile means sign of infection. Now, we have done with the latex allergy. And latex allergy is, we talked about earlier, and we said there are a lot of fruits also you are allergic to that. And remember, is banana, pineapple, passion fruit, and we wrote it down, BP pack. And what do you monitor with latex allergies? Underline the word. Urticaria, we all know. Anaphylactic shock. Wheezing, they're not able to breathe. And avoid latex product. Very important. Don't use gloves. All your catheters, bandages, some of bandages you have, Band-Aid, dressing, blood pressure cuff, balloons, condom, IV tubing. You have some syringes with that, and you have vials, medication. So add that, and do not use it. And also remember, I told you who is the highest risk for latex allergy? What babies? Which babies are? Myelomeningocele and spinal bifida babies are. And what is another word is called? Myelomeningocele. And remember the fruits, a lot of fruits also they cannot eat. So questions have been coming in. Allergies, all allergies, myelomeningocele babies and spinal bifida babies. So you guys add it. And remember that you got to connect, because when you're reading question, however the wording, whatever it helps you, you should know. Now, I'm going to go croup. Underneath it says implementation with the croup. Croup symptom at home. And write down another word for croup here, laryngeal tracheobronchitis, LTB. LTB is also another word, and we call the word croup. And what is LTB is laryngeal tracheobronchitis. Laryngeal tracheobronchitis. And when you have this and a croup word, that means upper respiratory infection. And breathing is a problem, and they are coughing. So write down the word more like a dry cough they have, and a breathing problem. And when you have cough, is very important is for treatment is shower, steamy shower, but write down the word cold. Everything you remember in your croup babies. Cold shower, cold air, cold humidified air, and also PO, fluids. Anything you're giving PO, don't pick up hot. Are we clear? Anything cold, cold ice cream, cold juice. Are we clear? No hot, so pick up that. And also no cough syrup. Write down the word no cough syrup. Because cough syrup dries up more and then they will have problem in breathing. So don't give cough syrup, don't give hot, only remember cold. And you can take them outside the house. If you're in the home, take them outside, cold air, let them breathe. Go in the basement, is cool area. Open the fridge, you're getting cold air. You go in the shower, open the cold water, so you're getting more cold steam. Are we clear? So croup is what? A breathing problem, and the child coughs, and it causes slightly more like a laryngeal-tracheobronchitis. Now universal donor, they can give, is O. O group can give everyone. 5% sodium bicarbonate can lead to metabolic acidosis solution. Then you have older adults are asymptomatic. Older adults mean old people. Sign of infection, underline the word confusion at the end. So if they have UTI, any infection, what is one of the signs for older people? Confusion. Are we clear? Sign of UTI. Not the young people, but older people. Mononucleosis comes from viral infection. Mononucleosis is, and write down the word Epstein-Barr virus. How do you get mononucleosis? Epstein-Barr virus. It's a Epstein-Barr virus is a problem, and patient has fever. And also, they have fever, sore throat, but very important, underline the word enlarged spleen. So Epstein-Barr virus called mononucleosis virus. Are we clear? So when we are saying mononucleosis, means it is caused by Epstein-Barr virus infection. But what are the signs and symptoms? They have fever, they feel cold, and also sore throat. But very important, underline the word spleen. And where is the spleen? Is on the left side. What do you tell the patient? So there is going to be a pain on the left side. And what do you tell the patient? To child or patient, avoid contact sport. And monitor for spleen rupture. And where is the pain? If the spleen is ruptured, on the left upper quadrant. So abdominal pain, sign of spleen rupture. Sometimes the question is also, what is mononucleosis? You will say Epstein-Barr infection. And what do you monitor? Rupture of spleen. Are we clear? Because it's enlarged rupturing. Lyme disease we did already. 3 stages of Lyme disease we did. Antibiotic, we talked about it. And tick bite. Now, lead toxicity. Poultry is unglazed, can lead to unglazed poultry, and also lead to lead toxicity. But remember, lead toxicity is very important. I did earlier, and lead toxicity damage the brain, the bones, and mental retardation. And what do? The treatment is you've got to remove the toxicity and write down the word chelation therapy. Chelation therapy, you give them. And what is in chelation therapy is we said the word BAL and EDTA. Very important, chelation. Chelation word means you're removing toxicity. Apgar score, normal, 7 to 10. White blood count after pregnancy, it gets higher, and that's normal. It's early sign, some infection. Ampicillin, all your antibiotic decreases your oral contraceptive. Are we clear? Decreasing the effect of oral, all your, and not only ampicillin, but remember, all your antibiotic can lower the is contraceptive effect. So what do you tell them? Use another method. They're going to get pregnant. Tricuspid area is fifth intercostal on the left side, on the sternum. Tracheostomy care, suction, and also change the dressing. No powder, but suction is okay. And also then you can go for dressing change is important. Tracheostomy care, what do you keep in the room? Tracheostomy set, and what is another word I told you guys? To keep it, because what happens if the tracheostomy tube comes out? Write down the word obturator. Obturator, to open up. Obturator, if the tube comes out, you got to keep in the room obturator, and same size your tracheostomy set. You got to have a sterile extra trach tube. Now we all have suction, we all have oxygen, but these two things is important, obturator and same size of tracheostomy set. So if that comes out, you cannot use it, but you're going to put another tube. So tracheostomy care is important. Hip flexion causes intra-abdominal pressure and thoracic. So what is hip flexion? When your hip you are bending. So where does it affecting? Abdominal area. C3, write down where it says C3, cervical. C means cervical. Cervical means neck. And write down the word spinal cord injury. So if your patient has a spinal cord injury and C3, what do you monitor for cervical 3 is write down the word respiratory. Same thing, C3, C4 also monitor respiratory, and C4 also I want you to write down upper extremity paralysis. They are paralyzed. So C means neck. If you have a neck injury question, or spinal cord, C3 and C4, what are you assessing first? Breathing. Are we clear? Respiratory. Maybe they're using word compromise. Compromise your breathing or respiration. Maybe ventilator. You're going to use the ventilator. Are we clear? So C3 is bad, cervical injury. Now, what is another cervical injuries are? Spinal cord injury. Now, remember, I want you to add there and start memorizing. I'm going in neuro. A spinal cord injury, if you have cervical, that is neck, and I already said C3 and C4 is bad. Thoracic means chest injury. Then you have lumbar. Whenever they are saying thoracic, that is your chest. Lumbar means back. L. So you have C, T, L. L is lumbar. Lumbar is back. And then you have is sacral. Sacral means the tail. In the lower part of the back, right here. This is your sacral. Are we clear? So what happens if they're saying patient has thoracic, lumbar and sacral? Remember, your patient is paralyzed lower extremity. Lower extremity. Are we clear? So what happened with spinal cord injury? Your upper extremity if you are in the neck injury. What do you do for neck injury? Immobilize. Are we clear? Don't move. What do you do for back injury? Don't move your patient. Keep them in the back. Are we clear? Do not turn them because it's all thoracic, lumbar. This is all your back. Are we clear? So that is why you will memorize your question. And what happened if your question is spinal cord injury? Where are you assessing paralysis? If you're having thoracic, lumbar, and sacral, you are paralyzed the lower extremity. Are we okay? So where are you paralyzed? Lower extremity. So everyone is okay. I like you to attach few things. Now, if you are paralyzed, lower extremity, I want you to remember for your Nclex question, what is the complication if your patient has spinal cord injury and they have thoracic, and they're saying T3 spinal cord injury. What do you monitor your patient? What is the complication? We have talked about it. What is the main complication after spinal cord injury? I want you to write down autonomic dysreflection. Very good. And what does it cause? What is autonomic dysreflexia? Neurosystem. And when you are in pain, it increases what? Hypertension. Your blood pressure goes up. Are we clear? Why? Because they have urinary retention or they are not able to pass BM, constipation. And also, when they are in pain, it leads to blood pressure. Are we clear? So what do you monitor if they give you a question, autonomic dysreflexia? What do you monitor for your patient for that? Or what do you monitor for autonomic dysreflexia? Check the bladder, check the BM, make your patient comfortable, and it's called autonomic dysreflexia. See how many things you put together, and everyone remember, how do you get autonomic dysreflexia? First thing is, it's a hypertension. Are we clear? And also, I want you to write down, sign of autonomic dysreflexia is hypertension, dilated pupil because of pain, and also is headache and piloerection. They will throw one of these wording. What is piloerection? Goosebump. Are we clear? Goose flush. Hypertension, dilated pupil, headache, and piloerection. So those are very important sign and symptom of autonomic dysreflexia. What do you do first thing? If they give you a question, your patient has autonomic dysreflexia, what do you do? Don't call the doctor. What do you do the first thing? Because of hypertension, what do? You want to lower the blood pressure. How do you lower the blood pressure as a nurse? Raise the head of the bed. When you make them sit, the blood pressure drops. So make sure, write down, because of hypertension, raise the head of the bed. And then you check the bladder, then you check the BM, and also you check any comfort of the patient. Are we clear? And then you call the doctor. Then you give the medication for the blood pressure. Everyone should know autonomic dysreflexia for your Nclex. Autonomic dysreflexia comes from where? From spinal cord injury. And what does the patient goes here? Hypertension, piloerection word, dilated pupil, headache. And what do you do the first thing? Raise the head of the bed. Then you go systematically check the bladder. Are we okay? Everyone is all right? Yeah? Yes? Okay. So everyone is okay. Where is your spinal cord injury? I said cervical, thoracic, lumbar, and sacral. What are the main problem for your patient is? Number one, breathing. Number two, paralysis. Are we clear? And what is third thing we remember? Autonomic dysreflexia. That's a complication of your patient with spinal cord injury. I will move on to the next section. It says SIDH. S-I-A-D-H. Where do we have S-I-A-D-H? Syndrome of inappropriate antidiuretic hormone. Where do you get antidiuretic hormone? What gland? Pituitary gland. So write down pituitary gland. And what is pituitary gland is producing? Write down ADH. And you have lot of ADH. So what happened your patient? What are the signs? It says cisplatin and plantinol. That's a cancer drug. So pituitary gland can also cause lung cancer, what they're saying, SIDH, and cisplatin is plantinol. That's a cancer medication. I want you to take your mind towards SIDH. What is SIDH is, remember, pituitary gland. And what is pituitary gland is producing too much of ADH. And what are they doing when you have too much of ADH? What are they retaining? Water or the fluid. So remember, they don't let them pee. So what happened? You're holding the fluid. Antidiuretic means you pee. Antidiuretic means you're not going to pee. So what do you monitor? Write down the word edema. Water intoxication, very important. ICP, very important. Seizure. If you will get the question, they are going to give you, what do you monitor for SID patients are? Water intoxication. What is in water intoxication? Write down the word SID. And also remember, when you're retaining fluid, write down another thing, low sodium, hyponatremia. Are you going to give water if you have hyponatremia and SID? No. Restrict fluid. Write down like that. So you can cover up half of your pathophysiology. This is his pathophysiology. What's going on with your patient? You got to connect. How do you connect? You got to understand the word. What is SID is? What is SID is? Syndrome of inappropriate antidiuretic hormones. What is your monitoring your patient here? What is pathophysiology? You are retaining fluid. And what is the fluid is doing? Cerebral edema, your body edema, and what is it increasing? Your blood pressure, you have edema, and also remember your specific gravity would be also is affected, and what happened, your patient are peeing less, so specific gravity would be high, blood pressure would be high, weight gain would be there. And remember, very important thing is you are retaining fluid. Only one thing is low, is your sodium. Everyone, without even looking your books, we all should know hyponatremia, no fluid. SID patients, no fluid. What do they have low here? Sodium. What do you monitor patient here? Water intoxication and safety. Maybe quiet room. Maybe non-stimulating room. Why? Because they're going to go into seizure. Now, we have talked about the chest tube. Underline the word water-sealed drainage is the second bottle. So when they're saying water-sealed drainage, that means you have some water. And underline that, and this is your first bottle from the fluid, and second bottle, you have water-sealed drainage. Third bottle is called your suction bottle. So water-sealed bottle has some water. And underline the word full fill suction control chamber, and they also have sterile water. Underline the word bubbling in water-sealed bottle. That means second bottle, if you have bubbling, that means there is a leakage. What is normal here? I want you to write down there, fluctuation is normal. Are we clear? Fluctuation is normal. And milking the tube in direction, remove the chest tube, underline the word. If they give you, you are removing the chest tube. What do you teach patient? Do Valsalva, pushing. Clamp the chest tube, so you clamp the tube, tell the patient to push and remove the tube quickly, and also apply occlusive dressing or Vaseline gauze. Then dislodge any tent dressing, tube become disconnected from drainage system, then is contaminated tip. So remove that. If your tube comes out from your connection, then you attach with a sterile connector and water-sealed drainage. Are we clear? I want you guys add normal in second bottle fluctuation. Normal in suction bottle, write down, is some bubbling, is okay. Small bubbling, not a lot of bubbling. And no fluctuation here. Remember, here is no bubbling, this is some bubbling, but no fluctuation. Are we clear? So those are very important, we all know, is the chest tube. Jackson-Pratt is drainage increasing in bright red. What is the meaning bright red? They're bleeding. When your bright red color comes, then what do? Notify the physician. What do? Notify the physician. All right? Then Penrose drain. Where do we use Jackson-Pratt? Write down the word Jackson-Pratt with T-tube. And what is in the T-tube with gallbladder surgery, cholecystectomy. Cholecystectomy. Gallbladder, when you remove, there is a T-tube, like a T-shape, and then what do you attach? The Jackson Pratt at the end. So where do we use Jackson Pratt when you remove the gallbladder and you have T-tube and you use is Jackson Pratt? This is a Jackson Pratt, small. I gave most of you the paper and I'll give the ones those who don't have, but remember Jackson Pratt. What do you do for Jackson Pratt is empty at the end of the shift. You squeeze it, you take out the drainage. If it is a bright red, then what do? Notify the physician. So what do you do for Jackson Pratt? Empty when you're going home, end of the shift. What do you do for Penrose drain? Penrose drain, right down, there is no bag. There's no bag, no drainage bag. And it's only a tube. It's a shape of tube. What do you do? Underline the word and write down there, skin care. Make sure change dressing and skin care. Tracheostomy cuff tube. What is a tracheostomy cuff tube means? Prevent aspiration of fluid. You are using and inflate during, why are you using tracheostomy tube is to prevent aspiration. And continuous inflate. When do you inflate? If your patient has mechanical ventilation, inflate during and after eating, inflate 1 hour after tube feeding, inflate when patient cannot handle oral fluid. So these are the one you have to inflate. When? To prevent aspiration. So we'll go on that. The next page, we'll move on 89. 89 page, you guys have, do not ask why on the exam. Morphine sulfate for pancreatitis cause spasm. So write down no morphine if you have a gallbladder and pancreatitis pain. Pancreatitis pain is very bad. Don't give morphine. What do you give them? Mapardine means Demerol. So write down the word Demerol. So no morphine. Everyone remember, no morphine, and you give Demerol if your patient has pain for pancreatitis or gallbladder pain. Is cholecystitis. So patient has gallbladder pain and pain is really bad, don't give morphine but give Demerol. I want you to write down no Demerol for sickle cell babies. Sickle babies are, do not give them sickle cell baby Demerol because it can cause seizure. And remember, connect something. So Demerol is given for pancreas pain, gallbladder pain, but do not give Demerol for which patient are sickle cell babies. Are we okay? Ecchymosis. Now, normal ocular pressure for glaucoma is 10 to 21 or 22 is normal. How do you measure the eye pressure? Write down the word tonometer. What are you using for pressure? Tonometer. You are checking tonometer and a pressure. Ecchymosis means is bleeding. Umbilical area or flank area. Retroperitoneal bleeding. I will ask you, write down, there are two things. Is patient is bleeding in who? With pancreatitis. They're bleeding. And we say Cullen sign and Turner sign. Turner sign and Cullen sign. Cullen sign is umbilical area, there is a bleeding. Turner sign is in the flank area, there is a bleeding. So everyone connect. Whenever they're saying your patient has ecchymosis in preumbilical area, that means you have pancreatitis. Are we clear? And another sign is called Turner sign. Everyone should know you have an Spiderman package, and I talk a lot about pancreatitis. I remind you guys to know about pancreatitis. I want you to write down few things. If you have a patient with pancreatitis, The pain is in the left upper quadrant. It's on the left side. And the pain radiates. Where does it radiate? To the back. Patient is having bleeding, and sign is called Turner and Cullen sign. Cullen sign is umbilical area, blood. Flank means in the back. Are we clear? I want you to write down third thing. You got to memorize pathophysiology. If they're giving you a question, pancreatitis, what do you do? If you don't understand pathophysiology, you're not going to do the right answer. Are we clear? I want you to remember, if you have a pancreatitis patient, the pain is where? Left side. Number 2, you remember, they're bleeding. Number 3, the pain is really bad and patient feel comfortable in fetal position. So that means they don't want to lay back. And they're saying my pain gets worse if I'm going in a recumbent position. Recumbent means back. Are we clear? So pain is good. They feel better. Write down like that. In fetal position. But if I'm going in recumbent position, my pain gets worse. Worse means your pain is really getting bad. So patient like to lay in fetal position. Are we clear? Where is the pancreas is? In the left side. Where is the pancreas? Left upper quadrant. Where is the pain radiating? In the back. Are we clear? And remember, what is the position? I'll finish pancreatitis, then we'll take a break. But let me put together. I want you guys to memorize in the right way. So pain is getting better in fetal. So now remember, your patient lays on the fetal position. So what's going on with the patient? They're not opening the lungs. And they're going to ask you, what would you teach your patient? Select all that, apply. They didn't give you, so what do you teach patient? Cough, deep breathing exercise, or incentive spirometer. Why? To prevent pneumonia. I want you to write down. So, see how much do you need to know pathophysiology. Pancreatitis pain, pain gets worse if they lay in the back. And what is the risk is here? Pneumonia. So what do you teach your patient? So select all that apply is, what pain medication are you going to give them? Demerol. Write down the word pain medication, Demerol. And what is the next thing you monitor if you have problem with pancreatitis? Jaundice. What is pancreas is producing? Your insulin. Are you going to monitor blood sugar? Yes. What else pancreas is producing? Your pancreatic enzyme. What do you digest here? Is digestion of fat. What food are you going to cut down? Fat. See how your pathophysiology. You will never be able to answer your question if you don't connect together. So what is it here is, everyone remember Demerol, jaundice word, and also remember blood sugar, pancreatic enzyme you got to give them if they're eating food. But because the pain is bad, when your patient comes, NPO, TPN, you're not giving food from the mouth because pain will get worse. So what do you give them? IV or TPN. Are we clear? Next thing I want to remember, they're bleeding and low calcium. What do you monitor low calcium? Technique. And what medication you keep available here with low calcium here is calcium gluconate. See how many questions can come and how many answers can you apply when your patient is coming with pancreatitis. Very important that we all know Cullen sign, Turner sign, bleeding, ecchymosis word, calcium word, pancreatic enzyme, sugar is affected. And now you can answer all, select that, apply. You're going to monitor. What do you do? Someone is bleeding. You give injection, you apply the pressure because the risk for bleeding. It doesn't mean they're bleeding here. Could be bleeding with the injection. Are we clear? These are your answers for pancreatitis. Everyone remember Cullen sign without even looking book. you should be very confident to say, where do you see Cullen sign? Pancreatitis. Where do you see Turner sign? Pancreatitis. What is the meaning here? Your patient is bleeding. What medication are you going to give them? Demerol. Don't pick up morphine. Why? Because it's going to cause the spasm. What position your patient would like to lay down? Fetal position. What do you teach patient? Cough, deep breathing. Remember, your pain is right here, your lungs are here, and you're not expanding. You are admitting for pancreatitis. Next morning, your patient has pneumonia. So as a nurse, we got to prevent them having is what these symptoms with pancreatitis. So you covered everything, and pancreatitis medication you give them is that. So what I will do, we'll take a break for 10 minutes, and then I'll continue the next pages, and hopefully we should be done today, this package, and it's a few more pages here, okay? Then I will do some other package, all right?